Hi, my name is Lewis. Today we're going to be looking at the intervertebral disc. We're going to look at the anatomy of the disc, the different types of bulges that you can get, the different stages of disc bulging, the type of symptoms you might expect with certain types of disc bulges, and the type of treatment that might be appropriate for it. Essentially, if we start with the spine, this is a spine made up of multiple free-floating vertebrae. We've got 7 cervical bones, 12 thoracic, and 5 lumbar. For the purposes of today, I'll just be going through the lumbar discs as the clients that we see the most and tend to have most disc problems in that area. So there's 5 lumbar discs situated between L1 to L5, and then we're on to the sacrum and the coccyx, which are fused. If we have a look a little bit closer, we have a disc here that sits between 2 bones. The structure of the disc is sometimes compared to a donut. It has an outer, harder, fibrous ring, and then within that it has a more jelly-like inside. And the jelly-like inside is called the nucleus pulposus, and the outer fibrous ring is called the annulus fibrosus. But essentially it's a bit like a donut. It has this fluid on the inside and a harder outside exterior. There's also what is called the vertebral end plate, which is just a few millimeters in width, and that is above and below the disc, and it's what is responsible for passing nutrition into the disc so the disc can stay healthy. Discs about 1 centimeter, 7 to 10 millimeters in height, and about 4 centimeters in width in the lower back. Their primary function is to allow movement through the spine. So because you have multiple free floating bones all the way through and discs situated in between, that allows for good amount of movement at each level, and if you multiply that throughout all of the bones of the spine, actually we get quite a supple spine at the end of it. So it's primarily for movement. Some texts will also describe it as a shock absorber. Throughout the day we see that as you're standing, the disc height reduces with the effect of gravity pressing down, and then in the morning after a night of laying down, the discs are at their highest. So that's a little bit about the disc, and then we have different stages of disc bulging. I'll go through each one individually. So we start off with a degenerative disc leading up to a prolapsed disc. Essentially, stages of disc herniation can be separated into 2 categories. You either have something that is contained or non-contained, or herniated is the other word for a non-contained disc bulge. Degenerative discs and disc protrusions are classed as contained discs, so they haven't, the nucleus pulposus, the inside of the disc, hasn't broken the outside wall of the disc at that point, and that's a critical threshold that if you cross, then certain treatments may not work for you, and you may have to consider other means of managing that problem. Degenerative disc and prolapsed disc, the outer wall of the donut hasn't been broken, the jam isn't visible, the jam is still within the donut, but it might be pushing out and misshaping the shape of that donut or the disc. So when a disc bulges, we see primarily when someone flexes forwards, because that puts pressure on the front of the disc, and the disc tends to bulge backwards, a little like an orange seed. If you squeeze it in the middle, it just stays where it is and compresses, but if you squeeze it on the edge, it's elliptical, so it tends to bulge backwards. So the discs in the lumbar spine are quite similar. If you flex forwards, you put pressure on the front, and it tends to bulge backwards. In the case of a degenerative disc or a disc prolapse, we're getting that bulging backwards into the joint space, perhaps pressing on a nerve, giving you back pain probably, and maybe some leg pain. And these clients should have a good response to a wide range of treatments. So joint mobilization of stiff joints, probably slightly away from the bulging disc, massage through tight muscles or muscles that have gone into spasm through the spine or through the glutes. Acupuncture, certain types of exercise, core strengthening, postural work should all help for that category, and time should probably help to heal that. And because it has an avoidance of the things that tend to make it worse, compressional activities like sitting for prolonged periods, repetitive bending and twisting motions. If you stop all that and try some of those therapies, it's likely that with time that disc is going to heal. These clients, because the pressure mechanism inside the disc is still intact, and the severity of the disc bulge is probably a little bit lower, they should have an excellent response to IDD treatment, particularly if they've got leg pain. Traction on that disc with the mechanism still intact should have a really, really good response. If we move now into the kind of second category of disc bulge, the non-contained disc bulge, within that category we have two, we can kind of subcategorize that further. So you have an extrusion and a sequestration. So we'll deal with those separately. An extrusion is where, as the disc is bulging and pressing out backwards, it's now torn the outer layer of the disc. The jam donut has a hole in it, a tear in it, and the jam is coming out, it's visible. This is a non-contained disc bulge. Typically will present with back pain and leg pain, and is usually a little bit more severe in the symptoms. These clients will probably not respond too well to most conservative therapies. So acupuncture, massage, joint mobilization, like we said before, they might help ease the problem, and time and avoidance of the things that tend to make it worse might help ease it, but it's probably not going to last, because the issue with the disc is that pressure mechanism being lost and the disc bulge is probably a little bit larger. So in these cases, traditional conservative treatments may not help as much as when it's a contained disc bulge. Those clients should be considering IDD therapy. I would say they've got a good, rather than an excellent chance of recovery, they've got a good chance of recovery. So there's something like 75% for a client in that category. Finally, we move to a sequestered disc, and this is still part of the non-contained disc bulge. So we've got a tear in the disc wall, but now the jam is not only out of the donut, it's separate to the donut. So it's a free floating mass of jelly-like fluid that has come out of the disc and is floating around. It's separate. And in these cases, because the material is separate to the disc, we can't predict the behavior of the disc. So it may track up or down or enter towards the spinal canal. So they're much harder to understand to predict what behavior they're gonna take when we decompress it. And so for that reason, it's contraindicated and not allowed on the IDD therapy. So if you have on your MRI report, it says sequestered disc or free floating fragment, then IDD isn't the right thing for that. It could potentially make it worse, so we wouldn't put someone on for that reason. Those type of clients should probably be considering surgery, depending on the severity of the symptoms and the state of the neurology.